Hey y'all, welcome back for a critical care NCLEX question of the day. Let's hop right in. Our question here says, the nurse is planning care for a client who had percutaneous coronary intervention via the right femoral artery 15 minutes ago. Which of the following interventions should the nurse include in the client's plan of care? Select all that apply. So we are going to have more than one correct answer here. And so let's look back first at our question. So we're caring for someone that had PCI or percutaneous coronary intervention 15 minutes ago. So what that means, we likely had a STEMI, we went in for a heart cath, right? We got a stent placed, more than likely. We went through the right femoral artery. Okay, that's a big thing to note here, and it happened 15 minutes ago, so this is fresh, okay? So with all of that in mind, let's look at our options. So option 1 says to place the client in the high Fowler position. This is an incorrect option. So with our clients who have access through the femoral artery, we need them to lay flat, okay? No bending at the hips. Usually like 4 hours. It'll kind of depend on hospital policy and some other factors like medications and whatnot, but we want them to lay flat. Okay, we just poked in the femoral artery, which is kind of right at your hips. So if we bend, we could open that back up and cause some serious bleeding. Okay, and when we have bleeding from an artery, it's going to bleed significantly more than from a vein because we have all that pressure behind it. So we want them to lay flat, really for as long as necessary, okay? Option 2 says to monitor the client's right pedal pulse every 15 minutes. This is a correct answer, and we'll talk about it in 1 second. Let's look at option 3, which says instruct the client to report changes in sensation to the right lower extremity. Okay, option 2 and 3 are both correct answers for the same reason. Okay, like we talked about, we were poking around in that artery. If we have bleeding, we're not getting perfusion distal to that site, okay? Our right leg, our right foot, that's distal, right, to our right femoral artery. So we need to be monitoring pulses, capillary refill for changes in sensation, and then instruct the client to report those things as well. Also, if the leg or foot are cold to the touch, that's a sign we're not getting good perfusion, and we would need to notify the healthcare provider. So those are correct answers. Let's look at option 4, which says inform the client that back pain is expected following the procedure. This is an incorrect option. Back pain is not expected following a PCI. So same thing, we're poking around in that artery, we're laying flat like we should be, right? We can have bleeding internally. So that blood, instead of, coming out and like visibly seeing it, that blood can go into the retroperitoneal space, which will cause back pain. Okay, we also want to be monitoring like vital signs and whatnot to check for other signs of bleeding. Which brings us to option 5, which says to initiate continuous cardiac monitoring for the client. We want to be doing this. We want to be checking vitals, looking at their EKG constantly for a couple reasons. We just went around and poked around in the heart, right? We put a stent in. We opened some arteries back up. The heart may not adjust well to that, and we need to be monitoring. Also, if we do have bleeding that's not visible into that retroperitoneal space, we'll see changes in the heart rate as it tries to compensate. So again, correct options here are 2, 3, and 5. Hey y'all, welcome back for another critical care NCLEX question of the day. Let's look at our question here, which says the nurse is observing staff members caring for assigned clients. The nurse should intervene if a staff member is observed doing what? So we are looking for an action by a staff member that is problematic, something we don't want to do. Okay, so option 1 says connecting a medication syringe to a client's arterial line tubing. This is going to be our correct answer. We should never, ever, ever connect a medication syringe to an A-line. So A-lines, arterial lines, or A-lines are used to monitor blood pressure continuously, second by second. They are inserted into an artery. Usually the radial artery is kind of the preferred site, and we can use them for blood sampling for arterial blood gases and whatnot, but we never want to give medications through it. Giving meds through an A-line can cause some serious problems. It can cause injury to the artery. It can cause gangrene, arterial spasm, all kinds of problems. So we just never want to do that. These meds should go through veins only, never arteries, okay? But let's look at option 2. Option 2 says administering crushed oral medication via a client's nasogastric tube. This is okay to do. We want to make sure the medication is able to be crushed. Some meds we can't crush, so we'd want to talk to the pharmacy about that. But we want to make sure we crush them finely, dissolve them in water, just make sure we flush that tube really well so nothing gets clogged. But it is fine to do. Option 3 says applying a new medication patch at a different site after removing the client's old medication patch. This is an incorrect answer because it's good practice. We definitely want to rotate our sites if possible for medication patches, and we always want to remove the old one first. That way we're not double dosing the client. Option 4 says administering nebulized medication via a T-piece to a client who is receiving mechanical ventilation. This is an incorrect answer because it's something we would do. A T-piece is an attachment that goes kind of on the end of the ventilator. It's a nebulizer essentially, but since these clients have an ET tube, we can't, do it traditionally. So the T-piece is just the piece of equipment we use to give the neb. But that's totally safe to do and really great for our clients on the ventilator. So we'll see you tomorrow for another question.